obviously a holistic OBGYN, and you mentioned about how common in medical establishments, like people go to the doctor or the hospital or wherever it may be, they're under the rule of insurance companies. They're probably, a 7-minute time allotment they have per patient or whatever. And how, to your point of how in the world can they really be present and really listening to the patient when you're under a time pressure and you're coming in with preconceived, oh, you've got this symptom, that symptom, the other. Oh, it's got to be this, because they're already programmed to make associations because they're already biased as to what they're expecting and what something means, rather than just being really present in that moment of what they're hearing, to just relax and open up to maybe where it might lead as to the root of something.
Yeah, I mean, we've done a lot of research on this, and most physicians, especially OBGYNs, which are, they're doing all the maternity care, they're doing all pelvic health for women, they're also doing a lot of primary care now. They're considered a primary care specialty, despite having a very serious specialty in the pelvis and, the host of issues that women bring to their doctors. That is your OBGYN specialty. And now they're also doing diabetes and hypertension and obesity management. And when you have to cram all of that into an hour, what ultimately ends up happening is, most patients are given like a number of minutes total of speaking time, because we have to get all the things done. We have to check all the boxes. And then if you also add on the documentation time and the clicking and everything else, you're looking at a computer screen while you're trying to help this person, but you're not even able to connect because you're looking at this computer screen. So the issue that I think, and the reason I stepped out of the system altogether, is that I want to really help people, and I can't do that if I don't have the time to really understand their story. Where do they come from? Where are they going? And why are they here? And like I said, that is therapy in and of itself, because most people are not getting an hour plus with their doctor to really, really iron out all of their needs.
Or even anybody. They might not have that real connection, discussion, conversation with any other human. I mean, or even at that deep level. I mean, if they spend an hour with someone, they might be like, yeah, did you see that show on Netflix? And my coffee's cold. And, but when was the last time, even to people listening or watching, that someone asked you, why are you here?